So today we're going to be talking about how to get an ADHD diagnosis and then what do you do? And I actually haven't prepared any sort of tips about that. I really want to use this session, hi Zaz, to answer your questions. I think the most important thing that I can do to be helpful to you is to have you talk to me about some of the challenges that you have in getting a diagnosis and then what to do once you have that diagnosis. And so I think that's actually more useful than me trying to tell you what to do, because some of you may already have a diagnosis and not know what to do, and some of you may need more support in getting a diagnosis for yourself or for your child. So let's start right out of the gate with talking to me. Put up in the chat, do you have a diagnosis? Do you have a child with a diagnosis? And if you don't, what would be on time? What would be helpful to you? Hi, Susan. I'm glad you're in time today. Thank you. Good to have you here. So tell me a little bit about who has a diagnosis who's here, and how did they get that diagnosis? How did you get that diagnosis, and what would be helpful? So we know that there are different paths to getting a diagnosis depending on your age and honestly, your socioeconomic status and your ethnicity. So a lot of kids are diagnosed immediately, or earlier, excuse me, and faster than adults because they're flagged by the school. The school notices that something isn't going quite right. They're having trouble paying attention in class. Maybe they have a coexisting learning disability. Maybe they're also on the spectrum, maybe they're twice exceptional. Either way, the school has put the wheels in motion. Sometimes parents notice themselves because they have ADHD and they say, this looks like very, very familiar to me. I'm going to take my child to the pediatrician or to a psychologist who will do a psych eval. So all of these things are ways that we get diagnosed. And I have to say, I'm just saying that Facebook changed their layout again, so I apologize. I'm just getting used to it. So let's see, we have here, so glad to see you all. Carrie has a teen with a diagnosis. Candace has a child with a diagnosis. Saz has a son with a diagnosis. Stimulant meds haven't worked, other options. I'm happy to talk about that today. Laura has a child and recently diagnosed herself at 42. Erica has a child. I think I have it also. Daughter 8 diagnosed combined moderate ADHD, diagnosed by psych and now in care of pediatrician. Emily, I got one when I was struggling in college when I was 18. I started the process for my son before he entered elementary. Oh, you're on it. Elena, one child has a diagnosis and we're waiting for an appointment for an assessment, can't do work on his own. Carrie, I actually knew my son had ADHD when he was born. It was very clear to me, as I'm a special needs teacher. We had him diagnosed by a neuropsych. Your son is very lucky, Carrie, to have you as a mom. Liz, hi from London. Hi from Northampton, Mass. I have a diagnosis and now feel cut adrift. Son about to get one too. Oh, let's talk about that. Xanthia, my son is 7, school done forms. I went to the doctors and we're waiting. We're in the UK. Any tips to help on education? Okay, so I'm going to write some of these things down. So tips for education and what to do once you have the diagnosis and meds. Let's see, there was a question. Susan, I have a diagnosis from just 1 year ago. So old, so surprised. Never too old, Susan. It's great. Diagnosis not due. Yes, I thought that's what it was, Liz. Your son, Veronica, Sally, child with diagnosis. I feel we're missing anxiety. Yep, we can talk about that a little bit. It's, of course, one of my best friends. Elena, you might have it. Ajit from England, hi. Okay, these are great comments. So Joe has a son diagnosed in 4th grade. They watched him since kindergarten before making the diagnosis. I don't know why. The psychologist just kept saying, wait, maybe he'll grow out of it. Okay, so let's back up a little bit. So let's talk about kids who are diagnosed And let's see, Saz says stimulant meds haven't worked. So stimulant meds don't work for everybody with ADHD. Sometimes non-stimulants work. Regardless of whether or not you're taking medication, we know that pills don't teach skills. And learning executive functioning skills is so critical for kids with ADHD that we have to actually really focus on that. And unfortunately, one of the most common things that we see in the United States is, and the research shows, is that more kids are just referred for medication, particularly when they're younger in elementary school. They're referred for medication and either therapy or coaching or parent education. But as kids age into middle and high school, those referrals for behavioral interventions go down. And that's really a problem because those are the exact times when kids need to learn them. Let's see. We have some of you feel like that your kids have been diagnosed, and you're wondering if you have them, particularly women who somehow may have been overlooked because women are internalize the symptoms of ADHD more than boys, who often are acting out impulsively or aggressively or hyperactively. Xanthia says, my son's 7. Okay, you're in the UK. Any tips on education? So Xanthia, could you ask me a little bit more of a specific question? Because I have, hours of tips on education and I need a little direction. Let's see. So Sally Ann, you're missing some things about anxiety which interferes with learning. Anxiety is a very common coexisting condition with ADHD, about 34% according to the research. I see this more, and most of my clinician friends see this more than 34%. What we see is, you may not have meet the full criteria for anxiety, but there's definitely a higher tendency for anxiety. And anxiety does interfere with learning because when kids are anxious, they're distracted by the physiological symptoms and the worry and the negative self-talk. Let's see, Joe, the idea that you're going to grow out of it, excuse me one second. Excuse me, I'm so sorry. The idea that you're going to grow out of it is interesting. I think when kids are young, kids are naturally developmentally active and curious, and they move around. And so some people like to wait to see, if that changes. Only 5 to 10% of kids with ADHD actually outgrow their diagnosis. And there's still some question whether they fully outgrow it or that they've learned the skills to live more successfully and effectively with it. And that's partially because the measures to assess adult ADHD are just not as robust as those for children. Wendy, welcome. My son is very impulsive, doesn't focus well. He is a foster child. ODD, how can we be sure? So how can you be sure about ADHD versus ODD? I think in the situation, Wendy, and good for you for fostering a child, that's lovely. You want to really work with a multiple information inputs. So from the school, with a counselor, from you, with whoever the social worker is, so that there's, a really comprehensive diagnosis. And then we want to talk to the pediatrician about what some of the opportunities for treatment are. There has been some research that treating kids who have had a trauma background with medication for ADHD can assist them in being calmer. We do know that for oppositional defiant disorder that the recommended treatment is medication, and oppositional ODD and ADHD, excuse me, is medication along with parent education, training, or family therapy, and that with those things, that when they're effective, that the ODD can kind of decrease and go away within 2 years. Sophia, I have a child who is 11 and I am 40, wondering if I also need a diagnosis. I am a teacher and feel so much more aware of the students I teach now. Well, that's a really good question. And, Annie, maybe you can put up in the chat some resources for people for women who are wondering if they have ADHD, because Attitude has a number of resources as well as some books for you to read and consider. Megan, my daughter is on Concerta, works very well, but wondering what will happen as she grows up. Will she need meds always? Who prescribes once over 18? Great question, Megan. Who knows? We don't know if she's going to need medication as she matures. Hopefully, when she gets older, she will have metabolized the skills that she needs to live effectively with ADHD. When someone is over the age of 18, their primary care provider usually prescribes for them if they're not under the care of a psychiatrist or a psychiatric nurse. Says absolutely need help to help schools understand this diagnosis. Right. So one of the things that we see in a lot of places in the United States and outside of the United States is that schools don't really understand ADHD and its co-occurring conditions, because ADHD rarely travels alone. And so, 70% of kids with ADHD have a coexisting learning condition. 64% of kids have a diagnosis of some other kind. So these are very high statistics, and we want to make sure that kids are getting the help they need. This means that we may have to offer articles like the things on Attitude or my book, to be shamelessly self-promoting, or other people's books, Barkley's books or Hallowell's books, particularly Barkley because he's written a lot about kids with ADHD. Thomas Brown, and articles to help educators learn more about ADHD, to help your child's teacher learn more. And that's not necessarily your job, but it's not your job either if you want to get your child the services and the support they need. Any tips for helping with executive functioning? My son loses everything, no support from school. So actually, this is so interesting. When I was at ADHD, I went to this great workshop with I think it was Richard Gallagher and Margaret Sibley. And Richard had this great idea, which I love, which is putting in in the backpack, like a laminated note that you pin of everything that needs to go in that backpack during the day, like when you go to school, when you come home from school. And then kids don't have to rely on their memory, they use their eyes. And this is something that is really helpful and can help your son keep track of his stuff better. I'm sorry that there's no support from school. I think that in cases where you're not getting the support you need from school, you actually have to ask for specifics. Ask for what you want. And how are you going to know what that is? By educating yourself about what executive functions are and interventions to help with them. Let's see. Laura, please talk about anxiety and ADHD for a child and minimum academic progress. Can we talk about non-stimulants too? I'm happy to talk about both of those things. Just a reminder, I am not a physician. I am a clinician. And I'm going to write here in the chat, oops, I'm sorry. I'm going to get for the chat link for my 5 C's, which will give you some information about executive functioning skills and intervention. So I'm going to put that here. Go to my website and download that. I think that will be helpful for you. Anxiety is a whole topic, and I'm happy to talk about that sometime again. When we're talking about anxiety with ADHD, what we have to do is remember that these are kids for whom who receive a lot of negative feedback and comments about what they're doing and what they're not doing. And this is a problem because those negative comments create a kind of vigilance over time, a nervousness, a negative self-talk. What am I doing that I shouldn't be doing? What did I miss that I need to remember? When is the next time I'm going to do something and get negative feedback for it when I didn't even know I was doing something wrong? So we have to help kids in terms of anxiety learn how to talk to themselves differently. Instead of saying, oh, I'm not doing that because it makes me uncomfortable, we want to help them learn to say, you know what? I'm not sure I can handle this. I'm scared. I'm worried about it. And but I have this, but I'm going to try it anyway. And I have the support of so and so, and I have this other resource I can use, so that kids feel like they can take a chance. In terms of non-stimulants, they work differently than stimulants. It takes a minimum of 2 weeks to kind of get up into the system, sometimes a little bit more. We're talking about Strattera or guanfacine or Intuitive. And those stay in the system. You know, they don't leave the system within a particular time framework the way that stimulants do. A lot of kids, or increasingly more kids, are, and I say kids, you know, children, teens, and emerging adults, are relying on polytherapy, which is a combination of stimulants and non-stimulants. This is particularly helpful for kids who struggle with emotional dysregulation, and and impulse control, so that they have help. They have that boost with the stimulants when they're in school, and then they have the non-stimulant to help them when the stimulant is leaving their body and after school. You're welcome, Nikki. I'm so glad you're here. Amber, first grader, diagnosed, no to school learning problems, diagnosed at first therapist. And of course, thank you, Facebook, took it away. Put it back, please. Got diagnosed in my 40s, had to grieve the late diagnosis. Yes, Ajit, all that time that you could have known and been treated differently and received assistance. Jamie, I have a 13-year-old son, ASD, ADHD, just diagnosed with NVD, and I lost that as well. NVD often goes along with ASD. In fact, some people don't diagnose NVD anymore, which is nonverbal learning disabilities. They just give the autism a diagnosis. Laura, I have a 9-year-old son in Australia, and I want to know what therapy would be best to help his impulsive ADHD behavior. He's diagnosed, been medicated since he was 5. Laura, I think the best thing that would be helpful for your son is family work, parent education, and cognitive behavioral interventions that you work on together as a family to help your son. There can also be some individual sessions with the therapist to help your son, but you actually are with your son much more than the therapist. And so tools for you to help him manage his impulsive behavior is really the way to go. And that's what the research shows as well. You're welcome, Trina. Sophia, my son was diagnosed with anxiety and medicated for that before he was diagnosed with ADHD. We see that a lot, Sophia. Kids will be, particularly girls, will be referred for and sent for anxiety, and then actually it's the actual ADHD that emerges a little bit later. When they're less anxious, we see that there's this other issue. I have a handout on that. I'm looking for it right now, and I'm going to put that up in the chat as well. It's on anxiety and ADHD. Check it out. You might also want to check out on my YouTube channel, where I have recordings of these sessions and other things about anxiety. Thank you. Thanks, Annie, for all that. Behaviors are not something we're born with. It's learned behavior. What neurology science proves brain distinction? I don't quite understand that question. So I actually think that there are environmental factors with behavior, but there's also biological issues, and we know that kids with ADHD have less dopamine and norepinephrine in their brains, which actually results in different kinds of have behavioral ramifications. You stated a medication for ODD. What is it? I actually didn't state a medication for ODD because I'm not a prescriber. Liz, masking his inattention, although a bright boy at school, causes my 9-year-old son's anxiety. His ADHD is less hyperactive. Can't wait to get him help now. Right. So actually, boys who are inattentive are often overlooked. Interestingly, the way that girls who are inattentive are often overlooked because they're not drawing attention to themselves, and they're less hyperactive. And so it is very important that he does get support, not just from the school, but also from you in how to manage his distractibility. Most often kids who have inattentive ADHD, drift off. They don't notice when they drift. They notice when they return from the drift. As they mature, as they age, they can notice when they drift a little bit more. We can identify what distracts them. You can, if your son is bright, he might be, and has personal insight, he might be able to identify what distracts him. The most important thing we want to do is give him coping strategies and tools for when he returns from that drift. Let's see. Pal, what are your thoughts on anti-anxiety medication? My son benefits from stimulants, however, they cause increased anxiety. So again, I'm not a prescriber. I think that I know that there are many kids who who take a stimulant and they take a selective serotonin reuptake inhibitor that targets anxiety. That might be something to consider. Janelle, where would you suggest to find resources, means of finding supports to help with weak points, for specifically processing speed, visual memory, and motor coordination, diagnosed ADHD inattentive type? I'm going to leave that to Annie to answer. I do think that Lynn Meltzer has done a lot of really great work on executive functioning skills, and I think she has a book out on it. Her focus often is metacognition, but she has a lot of great tools for that. Basil, hey, how you doing? When I received my diagnosis of ADHD age 41, I was only given Concerta. I was told that I had severe anxiety, moderate depression, mild mood disorder. Should I have had treatment for anxiety, depression, mood disorder? Personally, I would say yes. Why wouldn't you? I think that, this is, again, one of my basic issues, which is that people are given medication, but they're not given, therapy or coaching or behavioral treatment to help them, investigate their anxiety or depression or their mood disorder so that they can manage those aspects of their life. I mean, ADHD rarely travels alone. And so if you're just medicating the ADHD, then you're missing the rest of the picture. And the rest of that picture is very important. Joanne, Wicked Storm, not getting a good signal here. We'll catch her on the replay. Thanks. Homa, does bifenton ADHD medication interfere? I don't know that medication, so I can't answer that question. I'm sorry. Nikki, important to identify the experience, emotions and have that conversation by labeling their emotion. Yes, it's actually very important to teach kids, whether they have ADHD or not, how to put language to their feelings. This is something we learn over time. It's not something that's intrinsic to us. And when we can attach language to our feelings, we actually can exert better regulation of those feelings. Laura, my son always talks back and never stops talking, racing thoughts. It's a lot for the people around him. How do we help him? It would help me to understand how old your son is, Laura. I think that, there is a switch in ADHD brains, and that switch is that people who don't have ADHD have, which is sort of not the ability to not say your thoughts out loud. A lot of kids with ADHD, that switch is just broken. Russell Barkley's talked a lot about this, and so it takes time to learn how to. It takes them longer to internalize their language. Like, they can't talk to themselves in their head. They have to say it out loud. And so this might be something that you might want to have a signal for, maybe elephant or lollipop or something that would let him know that he's doing that racing talking and that this is a good time to take a pause. That's the first thing we want to do, is to build that self-awareness, that metacognition. Oh, I'm doing that thing. I need to slow it down. Okay. What are your thoughts on melatonin for bedtime? A lot of children I work with take melatonin for bedtime, but again, I cannot make any recommendations about medication. I can only suggest that you talk to your prescriber about that. Peter, hi. Are there any signs to see ADHD in younger kids, preteens? I see signs in my son via speech delays, developmental issues, and sometimes not being attentive in school, and his mom and teachers don't see it in him. Well, this is really interesting, Peter, because you're picking up on something that other people aren't. And perhaps you may have ADHD, so you see it yourself. And I think in this situation, what you might want to do is talk to your pediatrician or your primary care provider and ask for a rating scale that you could do, that your partner could do, that your that a teacher or two could fill out, and then those can be put together and sort of compared so we can see what other people are seeing. Tanya, do you recommend reevaluations at an older age, especially for kids who are diagnosed at a younger age? Yes. Evaluations are generally good for 3 years, but sometimes there's a lapse. But we definitely want to get kids reevaluated, particularly the year or by the time they're a junior in high school, if they're planning to go to college, so they can receive the supports that they need that are offered through school. Joe, my son was diagnosed with ADHD and ODD, then added anxiety, depression, and finally on the autism spectrum. Doctor only wanted to give him Prozac, which made him suicidal. That sounds terrible, and maybe it's worth seeing a different prescriber. What should I do to help his teachers understand him? There's some really great books about neurodiverse kids, and I think that and resources here. And I think that I would share those with his teachers because he has a lot going on. And so the expectations for him may be compared to neurotypical kids who don't have the same history. And we want to remember with kids who have the kind of history or the situation like your son, that what happens in education is they ask this question, why are you acting this way? Why are you doing this? And the question that needs to be asked is, what has happened in your life that has contributed to the development of these behaviors and responses? Okay, thank you, Annie. What type of therapist, like a physiologist or an occupational therapist? I don't know where to start with the type of therapist, helps with the family behavior. This would be a psychotherapist, so someone who's a mental health practitioner. I think occupational therapy can be useful, but I feel like the kind of therapy I'm talking about for family behavior therapy is someone who is either an experienced ADHD coach or someone who is a mental health practitioner. Basil, I have dyspraxia, ADHD, and Asperger's. I had a nervous breakdown to get my ADHD detected. My eating habits changed for a few months, less self-care. Should it have been detected earlier? You know, shoulda, woulda, coulda. I think the most important thing that you're doing is actually getting help now. Yes, Ryan Wexelblad is a great source of information. You're welcome, Peter. Hi, Kelly. The last time I did not know there was a main topic for these. No problem. Bring up whatever you want. Amber, and I'll try to answer it if I can, and if not, I won't. Amber, any advice for my 6-year-old? We are working with the school with ADHD, but they are very hesitant to give her a dyslexia test. We just had an eye exam, and she reads some of the letters backwards and some not. She even spelled her name backwards for the eye doctor as well. She also writes and reads some letters backwards, making her learning very hard. Why are they not willing to assess her for dyslexia? I don't understand this. It makes me mad. And I think that if you can get a letter from the eye doctor that says, I have these concerns, please do the assessment, that may help you have it happen. Oops, hold on. Okay. Ajit, I was initially on Concerta and the stimulation will wear off after 8 hours. I'm now on non-stimulant meds that last longer, but I feel I need the stimulation hit when I'm working. Yeah, that happens to a lot of adults and kids. Do you like the book, The Explosive Child? We are getting labels that are misinterpreted. I do like the book, The Explosive Child. I think Ross Greene is just fantastic, and that's definitely a way to go. So for some reason, I can't see any more responses. So if you have more questions, put them up in the chat because for some reason, good old Facebook I can't access them. So we are talking a little bit about how to get a diagnosis. There are different ways to get a diagnosis. There's a diagnosis through a school system. There's a diagnosis through a and that would include a psychoeducational evaluation. Schools cannot diagnose ADHD because it is a health disorder in the United States. They can say that that it looks like an attention issue, but they cannot actually give that diagnosis. Primary care providers or pediatricians and psychiatrists can diagnose the ADHD. Can diagnose ADHD. Usually with information from the school is very helpful, but they also will do their rating scales. I think the most important thing when you're getting a diagnosis is a multimodal assessment that includes rating scales, psychoeducational evaluation, information from classroom teachers, information from adult caregivers. Dale, how about the book I'm Not Crazy, Lazy, or Stupid for a Teenage Boy? I think that's pretty good. I think there's another book that is by, hold on a second. I'm having a moment. It'll come to me. I will tell you about that. I'll look for it. So, in fact, I'm going to look for that right now. I'm going to go to my reference list so I can tell you what the books are. Okay. Let's see. Okay, I gotta find it. Sorry. No. Okay, so there are a number of books by and for kids with ADHD. One of the things that we want to think about is I'm trying to find these books, and of course I can't find them because I'm under pressure. Let's see. Sorry, I'm so sorry. I can't find them right now. I'll try to think of them. I know the person's name is Chris. Chris Dendy is her name. Chris Dendy has written a book with her son about ADHD. You might want to check that out. Ajit, my daughter has anxiety and she is very conscientious. Her teacher said she is 12. I guess I need to keep an eye on her just in case she has ADHD. Yeah, nothing wrong with that. Kelly, what about us that are in the middle median of traits? I don't think I understand. We fall through the cracks. I see. So you know, you don't have, it's not a definitive thing, but it's not nothing. You're in the middle somehow. Not everybody needs to have a full-fledged diagnosis to improve their executive functioning skills. I think that you can obviously pursue a diagnosis, which would maybe help you get medication and particularly for kids services. But for an adult, you might do well with coaching or, ADHD-informed behavioral therapy that also does, insight-oriented work. That can be very useful. Joining groups also can be very helpful for adults with ADHD. Thank you, Annie, for posting that book list, and I don't have to struggle anymore. Let's see, Basil, having a routine with an unfocused mind, focused mind, or concentration for making decisions is helpful. Yes, it is. Thank you. Sally Ann, why are schools like my son so uneducated regarding ADHD? They don't follow IEPs and openly state that it's the result of parent. God, are you kidding me, Sally Ann? Of bad parenting. So frustrating because he is so smart and does try, hates school. What do? I feel he's falling behind. Oh my God, this is so upsetting to me. So I don't know why schools are like that. And I kind of think your son sounds like he might be a twice exceptional kid, a kid who has, very high IQ and maybe lower working memory or processing speed in relation to his verbal or his visual processing, his visual performance IQs. I think the thing to do if your school is not basically supporting you and they're telling you it's bad parenting, to get an educational advocate or to have a professional like myself, someone who's your therapist, to advocate for you with the school. If you're in the United States, you can call a team meeting and you can bring someone with you. And I think that's within your rights, and it's important to do that. Kelly Lynn, can we talk about the frontal lobe next time? Development for kids. Yes, we can talk about that. Frontal lobe development. So, okay, I'll write that down. Okay. Do you feel that people with ADHD need longer time for sleeping than a typical person? That is really that's an individual thing, because some people need a lot of sleep, and they have actually, because they have lower amounts of norepinephrine, they have trouble waking or falling asleep. And some people, adults and kids, just don't need that much sleep. It just depends. Thank you, Annie, for posting that on Gifted Kids. Ajit, you guys in the States are well ahead of the game compared to the UK with providing support. Ajit, actually, UK has gotten much better. I think it would be worth checking out. My friend Andrea Bilbao has started this organization called ADDISS, ADDIS, and they are a wonderful organization with lots of services and resources, so please check them out. Sophia, have you read Gabor Mate's Scattered Mind? I have not read that book. I have seen Gabor Mate speak, but I have not read his book. Okay, so now you have the diagnosis. What are you going to do? So for yourself as an adult, you may want to see a prescriber, but you also may want to consider joining a group, a support group, getting some coaching, finding a therapist who is ADHD informed, because I find the work with treating people with ADHD is a dance between behavioral interventions and teaching those executive functioning skills and supporting them, and emotional, insight-oriented interventions that address shame and the trauma of 1,000 little paper cuts of living with ADHD, and anxiety or depression or any of the coexisting conditions that go along with that. So one of the things that we want to do is we want to make sure that once you have a diagnosis, it's the beginning of the journey, not the end of the journey. And a lot of people, for them, they get the diagnosis and then they're overwhelmed by what to do. One of the great things about Attitude is it offers a lot of resources and regular webinars that are, interesting and helpful. Some of them are I love a lot of them. I learn a lot. And so you want to really think about, once you have a diagnosis, reassess what your goals are. What are the goals for you? What are the goals for your child? And how can you make sure that you're getting the resources that you need as a parent or as an adult with ADHD, and that your child is getting? And this is really, really challenging in some countries and in some areas of the United States. Many areas, and to be able to actually meet your kids where they are instead of telling them, what they should be doing and why they're not measuring up. Kelly says, it also seems as if rewards punishment is troublesome. Well, it's interesting that you say that. Punishment actually doesn't teach any skills. So that is not a great way to foster development in your kids. That doesn't mean you can't have consequences for things. And there are, logical consequences and natural consequences. And you can have, an agreement on a non-cooperation clause that you set up. We want to sort of think about rewards as putting the have-tos before the want-tos. You don't get a reward just because you wake up in the morning. But if you wake up in the morning and you're ready for school and you have 10 minutes, maybe you can play a card game. Maybe you can hang out with the dog, or you could read your book, or you could shoot some basketballs. Whatever you're interested in. I think that we want to be careful because we don't want to just reward, willy-nilly. We want to understand that extrinsic motivators, rewards, help kids until they can develop intrinsic motivation. And that really coalesces in neurotypical brains in the late teens, early 20s. So we're going to add at least 3 years. So it's in the mid 20s for a lot of people with ADHD. They have to learn that, oh, I'm going to eat dinner and do my dishes and then watch my show, so that tomorrow when I wake up and I have to go to work and I'm rushing, I don't have to also clean the kitchen. So this is the kind of thing we want to think about. Susan says, I hate the time change. Does it affect ADHD people more? Sleep is messed up for 1 or 2 weeks. I think that actually, because people with ADHD struggle with the sleep and alertness with the norepinephrine, it can affect people with ADHD a little bit more. Kelly Lynn says, sprinkle a little sometimes. I read that for help with language we guardians use. I think that sometimes is great, because always and never really are conversation closers. They're not conversation openers. And they don't actually help kids think about possibilities of what they're doing or their behavior. I want to say a few more things about what to do after the diagnosis. I think one of the things that's important that we want to do is we want to think about what we want to call ADHD with young kids in particular, because nobody wants to have a diagnosis or a disorder. I've met one kid ever. In fact, there aren't a lot of adults who want to have that. So what do we want to call it? And I think what you want to think about calling it is a name that's close to their experience. I'm a big talker. I'm a fast talker. I have a fast brain. I have a racing brain. I have a dreamy brain. I have a foggy brain. What is the experience of their brain? What kind of brain do they think they have? And then use that as the thing that you refer to. ADHD doesn't mean anything to them. Attention deficit hyperactivity disorder, what does that mean? What I think about it, it's one of my clients who was in high school. He says, I call it ADLS. I said, what is that? He said, attention deficit. Look, there's a squirrel. Another kid said, I call it, I'm awesome, I'm happy, whatever. I'm awesome, I'm delightful, I'm happy, I'm disorganized. So we want to really work with the creative brain, the outside of the box thinker brain that so many kids with ADHD have. Ajit says, from my diagnosis, I realized I need the right partner and the right job based on Dr. Hallowell's advice. I'm no longer with my partner, and I'm finding the confidence to indirectly explain my reasonable adjustments in a job interview. Good for you. Kelly Lynn says, hindsight, creative brain, the kids are bright. Yes, thank you. All right, so we are going to wrap this up for today. Thank you so much for joining me, and thank you for adjusting to the 4:30 hour. Next week, we'll be back at 4 o'clock, and I look forward to seeing you then. Please remember to check out the downloadable on anxiety and the one on the 5 C's, so you have some tools at your fingertips just as you leave our Facebook Live. Laura says, at what age do best to start therapy and coaching that's ADHD informed? My son is 9 years old, inattentive, ADHD, autism, anxiety, and leukemia survivor. He has significant academic struggles even with an IEP in place. I would say definitely get started. He also has a lot to cope with. Sophia, as someone with attention issues and ADHD in the family, I felt so understood by Gabor Mate's book. As the mother of someone with attention issues myself, I found inspiration, and our family dialogue has changed to mutual seeking of solutions rather than who's in control. You recommend the book. Thank you, Sophia. I'll check it out. You're welcome, Saz. Thank you, Annie, an attitude, and I really appreciate everything that you've done. You're welcome, Susan. Thank you, Ajit. I'll see you all next week. Have a wonderful weekend.